Welcome back to Accelerated Health Radio and TV. We're here with Dr. Amy, and we are talking all things sex hormones and the thyroid. And along with testosterone, one big issue that a lot of women have is estrogen dominance. But I wanted to talk first about how the testosterone under certain conditions in the body can be converted into estrogen and how that affects the female, and then also how that affects the or interplays with the thyroid and metabolism.
So testosterone can aromatize into estrogen. So the perfect example I can give you is if you've been at the gym and you've seen the meathead bodybuilders, right? They'll sometimes have a little bit of man boobs. That's because they are taking large amounts of exogenous testosterone. And naturally, some of that is converting into estrogen. And that's where they start to develop breast tissue, just like a woman. Now, really, those guys should be on an aromatase inhibitor, inhibiting that testosterone from converting to estrogen. Now, as women, we don't need to do that because we're not taking those large amounts. But it is good to be aware that some testosterone can convert to estrogen. And if you are dealing with estrogen dominance already, then you just kind of want to be careful of that. So that's where we can use things like DIM and calcium D-glucarate if you are on a testosterone therapy, just to make sure that bit of T doesn't convert to more and more E and raise your E levels. Estrogen dominance is a problem with the thyroid because it impairs T4 to T3 conversion. So just a little review for anyone who didn't listen to my interview with you before. And I'm sure you've talked about this on here, but T4 is inactive. T3 is active. T4 has to convert to T3. So when you were talking about iodine, T4 has 4 molecules, T3 has 3 molecules. T4 has to release one of those molecules and convert over into T3 to be active. So every cell in your body has a receptor site on it. I always make this little claw when I'm talking about the cell. It's got like a little receptor site claw that wants to pick up the T3. So every cell in your body has a receptor site on it for T3. We want that conversion to be smooth. 9 times out of 10, it's not really all that smooth because there's a lot of things that can get in the way. You had mentioned liver earlier. I love liver because it's got to be clean and working well in order for that T4 to convert over into T3 properly. Estrogen dominance will hinder that conversion. That's one of the many factors that will hinder T4 to T3 conversion. So now the reason why we test reverse T3 all the time is to make sure that you are converting properly. And in the case of estrogen dominance, we can see reverse T3 go up. Reverse T3 is like the bouncer at the club. It's sitting outside that cell door, that cell that wants your T3. It's sitting outside that door telling T3 you can't get in. No, you can't get in, and you can't get in either, and you're not getting in. So we don't want reverse T3 high. Well, estrogen dominance can push that up. That's why we don't. And estrogen dominance just causes a whole host of, and that's going to compound your weight gain. You're going to be retaining water like a camel. That's the last thing you want as a woman, is an extra factor causing weight gain when you're already maybe dealing with low testosterone. You're already maybe dealing with a low functioning thyroid. So we want estrogen in just that Goldilocks arena. Like we just want it just right. We don't want too much. We don't want too little, because estrogen is very brain protective and it helps our skin and it plumps up our skin, and it's anti-aging, and it helps during intercourse because you don't want to be dry. I mean, estrogen is fantastic, but we don't want too much and we don't want too little.
And it's kind of one of those questions of which came first, the chicken or the egg, when it comes to the thyroid health, Hashimoto's, and estrogen dominance, and that tipping point. I mean, can you have Hashimoto's leading to estrogen dominance and estrogen dominance leading to Hashimoto's?
You can. That's why it hits us more as women, because we have fluctuating hormones all of the time, and we do have more estrogen. So the combination of the low T and fluctuating estrogen with a kind of a predisposition, we are more predisposed to having estrogen dominance because we already have a large amount of E in our system anyways. And then when you start factoring in all the xenoestrogens in our life, from the plastics to the body wash and body lotion you're using, the air that you breathe, the water that you drink, all of those toxins can be fake estrogens, xenoestrogens. And that can kind of compound on your estrogen dominant state. You may or may not even see that in the labs, but you can still be in that estrogen dominant state, which can interfere with thyroid function and flip that switch again. So that fluctuating estrogen that women have, the naturally lower testosterone than a man that women have, puts us more at risk for Hashimoto's than males. And that's why there's that discrepancy in numbers. That's why it hits us more.